Hello, everyone. Welcome to another episode of the Pathology Network podcast.
As Pathology Network, we came up with the idea that it's possible for all Kenyans to access high-quality lab services. For the doctor and for the patient, all they know is they've ordered a test, it's on its way, the results have come back, and they're on time and they're good quality. We'll take it to the appropriate lab, take it to the appropriate pathologist, and keep the standards along the way and deliver the results. The mechanics of all that we had to do to make sure that happened, that's not on them, because we want them to concentrate on treatment.
So just to recap, the cost consideration should not be for the patient, it should be for the doctor who's treating them. They are the ones who can fully understand and grasp the importance of having a pathologist look at their samples or be involved in the diagnostic process. Is that right?
Yes, absolutely. And also the policymakers and regulators who need accurate disease data to make decisions.
For sure. They are also major stakeholders in the perception of cost and allowing the perception to be positive so that these services can be taken up and used in the way they need to, because they are critical for diagnosis and for management.
Absolutely. Another key stakeholder when in the cost discussion are third-party payers.
Like insurance companies.
Insurance companies. National insurance companies, private insurance companies, relatives.
Yes.
These third-party payers want to know what was the diagnosis? Was that surgery necessary? Was that treatment correct?
Gotcha.
Because they certainly don't want to pay again.
No.
Because it was not the first time.
Done the right way.
Because it increases the cost of healthcare.
For sure.
You can imagine every time you have an unnecessary surgery, it's like, oops. That we could have, we have to do this again because we operated the wrong way, or we have to give you different drugs because we didn't get the right diagnosis before. So you see that it just increases the cost of healthcare not to have a proper diagnosis the first time. Yeah.
So the stakeholders are the requesting physician, the treating doctor, policymakers, people who will be need the data for disease to be able to make plans, national plans sometimes, as well as third-party payers, people who like insurance, sometimes it's family members who need to have proper diagnosis so that the treatment can be accurate to avoid other costs. And the costs that come in on the side of it tend to be quite high. If you have to go back to treat something because you didn't do it the right way, that cost tends to be high because it's like a whole, you're beginning from scratch again to now make the treatment. A bit about the Pathology Network. I think we're beginning to kind of get an idea of what the company is, what the company does. Is all these, then it's a network basically connecting doctors and patient samples to labs, and then again from the lab to the pathologist. This network, the logistics behind these different steps are handled by the Pathology Network. Am I right?
Yep, absolutely correct.
Cool.
It's complex. So, for a doctor, let's say, a doctor somewhere we were talking about Msambweni. They don't know the best lab that can do, prostate pathology. But we know that because we're prostate pathologists. And, we do that.
We process the specimens.
We process the sample and all that. So we have all that information. So it's the Pathology Network is that in between. We say, order from us, and we pick it up from Msambweni. We'll take it to the appropriate lab, take it to the appropriate pathologist, and keep the standards along the way and deliver the results back to the doctor in Msambweni within within 7 days for tissue pathology, for example.
Right.
It's something which we are able to do consistently.
Right.
Yeah, that's what Pathology Network does
Right.
for now hundreds of doctors and patients every month.
Right. So the logistics behind it, as well as maintaining a high level of quality,
yep.
that is the work of the Pathology Network.
Yes.
So all the requesting doctor has to do is put in a request for the test.
Just put on request online.
And then just wait 7 days, and then you have your good high quality report.
Exactly. And they can track.
Excellent.
They can track on their phone and on their software where it is in the process.
Right.
Just like you would on DHL when you're sending a package.
Yeah.
Same thing, you track, it's arrived. For us, it's arrived. You also know the steps in the lab, and you know when the results are out.
Right.
When the results are out, the patient gets a message that the results are out. Go to your doctor, and the doctor can then release the results.
Right.
Yeah, and sometimes that makes a very big difference. Mm-hmm. I once saw a patient who traveled all the way from Turkana to halfway across the country.
Right.
Towards, let me just say, some part of South Rift.
Right.
And like 300 kilometers. He traveled 2 weeks after the test because he was told your results will be ready in 2 weeks, and he got there and the results weren't ready. So he was told come back in about 5 days.
Yes.
The results may be ready by then. Like I felt
that's
like that was
phenomenal. Like
it's completely insensitive. Go
back to Turkana and then come back. And
yeah.
The thing is, like what we were saying, is that at the point when you get your results, that is just diagnosis.
That's the beginning of the journey.
Yeah. So the treatment then begins from that point.
Yeah.
And it can really be heartbreaking if that process is too long drawn out, too expensive, and demoralizing for an unwell patient.
Exactly.
Yeah. So the government of Kenya is about to introduce a new health fund through the Ministry of Health. It's being called SHIF, or the Social Health Insurance Fund. And the goal, as described by the government, is that patients who previously were unable to access healthcare, so patients outside the system who were marginalized because of this lack of access, can now access healthcare. What steps are being taken or are currently in place to align with that system, which is practically going to cover the whole country?
Yeah. Well, I can say that with confidence that SHIF is aligned with TBN, in the sense that we existed before SHIF existed. Mm-hmm. As Pathology Network, we came up with the idea that it's possible for all Kenyans to access high quality lab services. Now, SHIF wants to take healthcare to all Kenyans. Mm-hmm. So we are like two peas in a pod. Like we're literally, made for each other. Right. We connect currently 5 labs in this country to 14 pathologists. Mm. We hope, actually planning that at the end of this year, we'll be connecting 7 labs to 20 or 25 pathologists. Mm-hmm. The capacity that we have literally can serve the whole country. Right. We can serve the majority of patients who will need the kind of advanced tests that need to be ordered from the Pathology Network can be covered by that number of pathologists. Right. And not only do we have the pathology capacity and the lab capacity, but the technology infrastructure and the logistical infrastructure to manage volumes of patients. Got you. Currently, the labs that exist and the infrastructure, the way it's designed, piles hundreds and hundreds of specimens on a single lab. Right. With some pathologists who are there. Often not very many pathologists. And usually not very many pathologists. Mm. There is no lab that on its own can handle Kenya's workload. It's just not possible. Right. Without having a system that distributes and balances the workload across existing resources, you're not going to maintain quality. So what's going to happen is, SHIF will do a great job in extending healthcare to these remote areas,
right?
And then all those samples and all the samples that need to be diagnosed will end up in a lab and get stuck,
right?
Because that lab doesn't have the pathologists,
right?
But with the pathology network, all that work will be distributed among several labs and among all these pathologists,
right?
And so it runs well.
Right.
Yeah, and from a cost perspective, also very easy to reimburse and to keep track of and all that. So I feel like in terms of alignment, ours is a health system solution, literally built for
SHIF.
For government systems,
right?
National healthcare systems,
right? Okay.
Or systems that are treating people in multiple institutions, like SHIF.
Like SHIF. Okay.
Yeah.
So this scalability of the pathology network.
Yeah.
It's because the pathology network leverages tech to create a digital system that allows this volume of cases to be absorbed and that a number of pathologists to be connected to this number of labs and doctors.
Yes.
Talk to us a bit about the tech or the digital stuff.
The digital stuff.
Right.
Yeah, the digital stuff.
Briefly, I know it may be a company secret, but briefly.
Yeah. It's a need-to-know basis.
Trade secrets.
Yeah, we have developed a technology, software system, a cloud-based software that has logins for everybody. Login for the hospital level, the doctor who's ordering the test, the hospital where they're working, the lab tech who's in that hospital, the patient. We're working on a patient application as well. The people coordinating logistics, which are customer service and logistics staff.
Right.
The lab that's doing the processing, and the pathologist who's doing the reporting. All of them are connected on one platform. And then we have a way of monitoring what's going on and having reports on a constant, daily basis.
Okay.
So it's quite a system, I have to say, and it's pretty complex.
Right.
But to think of it in a simple way, it's like Uber that has been supercharged for health.
Right. Uber for pathology.
Uber for pathology.
Uber for healthcare.
Let's not give them ideas. But yeah,
we'll cut that out.
But if you think about Uber, it actually, you order a test. You order a cab.
Right.
You want transportation. You want to get from point A to point B, and they figure out which driver is nearby, which one can come, which one has the car. Apparently they even figure out who did you ever ride with that you didn't like, and
yes, they do.
And they make sure that you never meet again. Stuff like that. So they do all that. All you know is there's a car that's coming.
Yeah, I want to go here.
And it's arrived, right? And then it takes you there. So the system that we've created is similar to that. Is that for the end user, for the doctor and for the patient, all they know is they've ordered a test, it's on its way, the results have come back, and they're on time and they're good quality. But the mechanics of all that we had to do to make sure that happened, that's not on them, because we want them to concentrate on treatment and concentrate on getting the patient better.
Right.
Yeah.
Excellent. So tech is a big part of this. I think without tech, it seems like it would be not possible to create a system solution like this.
Yes, impossible.
Right.
Well,
makes sense.
Yeah, very, very, very difficult.
I mean, you'd need a lot of manpower, I guess,
paper.
and paper. And I mean, it's
just not, you wouldn't be able to do it.
Right.
Yeah.
Okay. So what are the future frontiers for the Pathology Network? Where is the network headed?
Well, what we've realized is that certain use cases can be built on top of the network.
Right.
So, for example, now we have the IANA project, which is a very specific project focused on mass screening for cervical cancer.
Right.
Testing women for HPV, human papillomavirus. And the software and the systems for that screening have been built on top of our existing software,
right,
which was being used for these other tests. And now it's focused on that one specific use case. So programs like that, this IANA project is a 6-year project targeting 3.5 million women.
Right.
That project, which is an amazing project, is a representation of the kind of things that can be built on top of this system.
Right.
If you can have something for cervical cancer, you can build a system for, a specific pathway and testing system for tuberculosis or for something else.
Right.
So programmatic things like that can be built on TP, and in the future I'm seeing that being a potential way in which Pathology Network will engage with different, governments.
Right.
In the future. We also are looking to expand to a number of countries that need our services. Remember that there are so many countries that don't even have a pathologist or have 2 or 3 or maybe 1 pathologist. We can connect them through our software and through our systems to countries where there is a relative, excess of pathologists. There are more pathologists. So we can connect a country in Africa to India or to the UK or to the US or to some other country that has more pathologists than they have.
Gotcha.
You see?
Yes.
For diagnosis using digital pathology and other systems.
Right.
And that's something that we want to do because I think that's going to really add value to healthcare systems on this continent. We also will be incorporating AI.
Right.
It's a big part of our future to interpret some of the diseases and to give a preliminary diagnosis so that the doctors have something to work with, and pathologists come and basically mark the AI or just say, I agree or don't agree, or it can screen the test ahead of the pathologist. A lot of this is already being done in radiology. Radiology has been using technology for a lot longer than we have.
Yes.
And right now, algorithms in radiology can diagnose X-rays and CAT scans and all these things, sometimes better than the radiologist, which is worrying.
That is very worrying.
But it's happening,
It's true, yeah.
So I think that's coming to pathology to some extent.
Right.
And this is part of the future, so that you don't have then to train thousands of pathologists to be able to meet the needs that you have today for your population.
Right.
And so Pathology Network will make that happen. It'll bring that AI to the doctor in a country that doesn't have. We'll take it to Msambweni. We'll take the AI to wherever and really help to improve the quality of the diagnosis, the speed of the diagnosis.
Right.
And
Right.
So those are some of the things that we see coming up in the next couple of years.
Okay. So just to recap a bit of what you've talked about, some of the things are, there's a new project, HPV DNA testing for screening for cervical cancer for women. It's called the IANA project.
IANA
project. And that's embedded and using the software and experience, I'm guessing as well as the experience that the Pathology Network has with diagnosing these other tests. So it has its own software.
Yes, it has kind of like a simplified, focused version of our software.
Right. Yeah. Based upon, so the other things can be made for different other pathways like that. So this is for cervical cancer, HPV DNA testing. Yeah. The potential is massive for other diseases, other pathways of screening and treatment management, right? And then scaling up to other African countries, being able to bring the service and the resource, share this resource of pathologists with centers that may not have or have access to it. So the final thing is the incorporation of AI, allowing pathologists to diagnose faster, diagnose more, and bring the service, make the service even more available to places that may not have access to a pathologist. Excellent. Yeah. So the future is bright. The future is big for the Pathology Network.
Future is tech, and we're unless the internet collapses.
So you're at the frontier of this incorporation of tech into medicine, into pathology. Into healthcare, really, and the potential for the improvement and the betterment of healthcare through the use of tech.
Yes, that's what we're doing, and we'll keep doing that. Yeah.
Right.
Yeah.
Is there anything you'd like to add before we wind up the episode?
No. I think this is really great. It's been a long time coming to this, and sometimes I think people may not know how many things need to be fixed before a solution is ready for the market.
Right.
Standardizing processes in the background so that you get a service that is always the same, always at the same level of quality. It takes a lot of work. I have a lot of respect for anybody who's able to do that.
Right.
You walk into a restaurant that's a chain of restaurants, and the coffee is always the same, and across all the branches, no matter where you are, the coffee is the same, served the same, same temperature.
Yes.
The cookies always taste the same.
Yes.
I think that's possible in lab medicine to operate at a certain level of quality. But it was highly, highly complex.
Right.
And I think we're now getting to a point where we can say that we've been able to do it, at least for the tests that we currently support.
Right.
Yeah. So it's exciting times for the future.
Excellent.
Yeah. We look forward to taking this beyond Kenya to East Africa, rest of Africa, and the world.
To the world.
Yeah.
Right.
Yeah.
Excellent. This has been our episode with Dr. Joshua Kibera, the CEO and founder of the Pathology Network. And my name is Dr. Maureen Waithaka, a pathologist, and I want to say thank you for joining us. It's been great. See you on the next one.